Good afternoon. I understand you have some concerns with your facial symmetry, is that right? Okay. Any other concerns? So, uneven movement, and one side feels different. Okay, which side? Okay. Okay, so when you've had pictures taken, you can tell a difference. Okay. Any pain anywhere? Okay. Right, so if you could just stay nice and still for me, I'm just going to observe your face, but please don't make any expressions. Okay, thank you. So let's have a look what's going on. Okay. Has this ever happened to you before? Okay. Okay. I can definitely see that that side is slightly lower, alright, overall. And then I can see that this eye slightly drooped, okay, as is your mouth, alright. And obviously I can see it's not level. Now, this is the first time this has happened to you, and I'm guessing it's causing you a little bit of concern. All right. Now, when this started, was you doing anything in particular, or has it just been a gradual thing that you've noticed? So no signs of a stroke. Okay, good. Now I'm watching you blink naturally, and it's fine. Alright, I can't see that the blinking's off, but I'm going to get you to do a couple of things in a moment. Okay. Okay. So, first of all, I would like you to just blink normally. That's no forced blinking. Good job. Okay, now could you blink really fast for me, as fast as you can? Okay, stop. Okay, then fast but not too fast. That's it. Okay, now can you do it quite slowly? Okay, now when I tell you to, blink, okay? Blink. Blink. Blink, blink. Blink, blink, blink. Blink. Blink, blink, blink. 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 Okay. Okay, now if you can look straight ahead and try not to blink for me, okay? Good try. And try not to blink again. Okay, good job. Okay, now can you wink at all? Can you try this eye? Okay, what about this one? Okay, so you can't really wink that side, but I don't know whether you've been able to before, so I'll just question mark that. Now, could you squint for me? Okay, now open your eyes really wide. Okay, let's definitely see that side struggling there. Okay, now just close your eyes for me and just keep them closed. Okay, now if you could close your eyes nice and tight, that's it, squeeze them. And relax. Okay, right. If you could raise your brows for me and hold it. Okay, relax. Okay, can you frown? Okay. Can you scrunch your face for me? Okay, one. Relax. Alright. Okay. Okay, now could you smile for me? Okay. Now can you smile and show me your teeth? Okay, so I can see they're struggling to lift up over your tooth. Okay. Relax. Okay, now just show me your teeth. Okay, relax. Okay, can you puff out your cheeks for me? Okay. And can you wiggle your nose at all? Okay, can you blow your nostrils? Okay. What about twitch your nose? Okay. Can you purse your lips for me? Okay, relax. Okay, would you mind just opening your mouth as wide as you can for me? As far as you can go. Alright, and close. And now just casually open and close your mouth. Okay, relax. Could you do a chewing action? Okay. Okay, now would you mind just moving your jaw side to side? Okay, so when you're moving your jaw, do you get any pain at all? Okay, any discomfort? Okay. Now, can you just clench for me? Okay. All right. Okay. Now you've done all those exercises for me, do you feel like your face is tired? Okay. Do you find you get a lot of face tiredness? Okay. Any tension in any particular place? Right. Okay. Do you normally have any jaw issues? Okay. And do you normally clench or grind your teeth? Not that you're aware of. Okay. Has the dentist ever said that to you? No. Okay, if you could just open your mouth for me. Let me just have a look at your teeth. Yeah, I can't really see any signs of chronic grinding or clenching, which is good. The sides of your mouth, potentially a bit of scarring here and here, okay, which does indicate kind of clenching and grinding. But your teeth look okay, so I'm not too sure on that. Best to check a dentist on what their opinion is on that. All right. Okay. I'll take some measurements in a moment. Right. Just as you're sitting here with me right now, do you have any pain anywhere? Okay, what about tingling? Okay, and what about numbness? Where feels numb? Yep. Okay, thank you. Is that sensation there all the time? Okay, does it ever feel worse at any time? Okay, all right. So I'm going to take some measurements now. Okay. So okay. Right, maybe okay. A little bit more to the ears. Okay. Okay, let's do. Okay, so just the gap between them. That's there. Okay. Can get that down the centre there. 1, 2. Okay, 5. into, okay. Okay, let's do this video. 6, 8. Okay, about this one. 5, okay. Okay. Do you have any lip filler at all? Okay. What about any Botox or dermal filler? Okay. Any facelifts or anything like that? Any metal plates or pins? Okay. One, 2, 3, 4. 1, 2, 2. Okay. Check across. We've got 13, 10. Okay. 12. Okay. Okay, yes, right. I'll put that there down. Okay. Okay. Close your eyes. Okay. Okay, I'm going to take some pictures. Keep nice and still for me and look straight ahead. Okay, and bend your head back for me and hold it. and back down. Turn that way and raise your head slightly and back at me. Look that way and raise your head slightly and back at me. Good. Okay. Could you smile for me? Okay. Okay, relax. Keep nice and still. You tilt your head up. That way. And tilt your head up. And that way. Tilt your head up. And back at me. Good job. Just going to do some tracing. Okay. Can you smile for me? Relax. Okay. Okay. I'm going to touch your face, okay? Can you feel that? Okay. Now, does that feel like that? Does that feel the same as that? That. Okay. Okay. Now I want you to tell me if you can feel this. This. Okay, so you know what it feels like. Okay, can you tell me when it touches your face? But I need you to close your eyes for me, okay? Okay. Can you feel this? That. Okay. Can you feel this? Okay, tell me when it touches your face. Okay, can you feel that? That. Okay. Can you feel this? This. And this. Okay, tell me when it touches your face. Okay. Okay, I want you to tell me if it's sharp or dull. Okay. Okay, can you tell the difference? Okay. I want you to tell me if it's soft or rough. feel that? What's it feel like? Okay, tell me when you can feel it. Okay, good job. Okay, can you feel that? Okay, tell me when you can feel it. Okay, can you feel that? Okay, can you feel that? Do they feel the same or different? Okay, so tell me if it's sharp or dull. Okay. Good job. You can open your eyes. Okay, close your eyes again. Can you tell me if it's cold or warm? Okay, thank you. You can open your eyes if you wish. Actually, I'm going to do one more. Can you just close your eyes for me? Okay. Can you feel that? And that? What's it feel like? Okay. Good job, you can open. Okay. Okay, I want you to tell me if you feel any pain or discomfort or any weird sensation, okay? Mm-hmm. Mm-hmm. Close your eyes. Thyroid gland now. Okay. So we have tension in temples, masseter. We have no. Okay, and I can feel tightness. Okay. Okay, so is the numbness more here? Okay. Yeah. Okay. Alright. I'm just going to have a look in your eyes a second, okay? Look straight ahead. Look up. Back at me. To your right. To your left. Back at me. Okay, now follow my light. Just with your eyes, okay? Good job. Okay. Look at my nose, okay? Tell me when you see a hand or fingers move, okay? Keep looking at my nose. Okay. Okay, tell me when you can't see my fingers anymore, but keep looking at my nose. And tell me when you can see my fingers. Keep looking at my nose. Good job. When did you last go to the opticians? Okay, I'd recommend you booking an appointment at the dentist and the opticians just for a full exam, alright? I'm just going to observe your posture, just see as you would normally. With the drooping, etc., is it just your face or have you noticed it with your body as well? Okay, so just your face. Okay. Just smile for me. Okay. Show me your teeth. Puff out your cheeks. Close your eyes. Raise your brows. And relax. Okay, right, so putting everything together, I know what's wrong with you. Okay, you have what we call Bell's palsy. Have you heard of it? Okay, so basically your seventh cranial nerve is inflamed. It is only temporary, but it does need treating, alright? It can last up to 6 months, give or take, but if we don't get it treated, it will just keep getting worse, alright? So this could be triggered by stress, weakened immune system, or an infection. Have you had any cold sores? No, okay. Have you been sleeping all right? Okay. Not the best, okay. And have you been stressed a lot? Okay. Anything in particular? Okay, that could potentially bring it on in itself. I'm sorry to hear you going through that. Hopefully you'll get things sorted soon. Alright, my lovely. So, it's quite common in diabetics. You've got diabetes, okay, and high blood pressure. Okay. And have you had any recent flus or colds? Okay, and when was that? Possibly. Yeah, even though it was a few months ago. Okay. Alright, so let's get this treated. What we need to do is try and reduce your stress level, alright, and try and help you sleep better. Alright, so maybe try taking some Piriton at night, as that can have a sedative effect, and hopefully that will help you a little bit without giving you too much of something else. Alright, but maybe listen to some ASMR, some relaxation music, maybe some meditation or something like that. Okay, or some sleep stories, that would be really nice. Okay, so you need to lower your stress level is a must. Get some fresh air and keep hydrated, they are essential. But you do need to go on some steroids. Okay, so prednisone we need to give you. Okay, we need to start them ASAP. Alright, all the instructions will be on there and how long to take it and when, etc. Alright, I don't feel we need to give you any antiviral medication at this stage. I feel like it's not that severe, and if we start this treatment now, it should prevent it and we won't need to go any further. So steroids are going to be full on to get this under control. Alright, then you're alright to take pain relief, paracetamol, something like that if you need to. Alright, then I'm going to give you some eye drops for the day and then some ointment for night. Now I know you said you've had this for a couple of weeks, but we need to make sure that the eye doesn't get stuck. Alright, it needs to keep lubricated. Okay, yeah, because obviously this treatment we need to be on for a little while, and it's not necessarily going to be an instant effect where all of a sudden your eye is going to be nice and wide. Alright, so we need to give you some of that. Yeah, you've noticed that, bit dry, a bit gunky, stuck together a little bit. Yeah, so we'll give you some of this. It will help keep your eyes lubricated and not sticking. Alright, and you'll get the instructions. It will tell you how to use the ointment. Alright, and then I'd recommend massage. Alright, so you could use your own hands. You could maybe get like a lymph drainage kind of brush or something like that. You could see somebody for a massage, but with you having this condition at the moment, they may not treat you. Alright, so we just want to be doing like massage up here around the face, you know, drainage massage. Just do some searching about drainage massage, lymphatic drainage, and you know, massage for Bell's palsy, and get yourself some brushes and things like that, and you can do that yourself. Yeah, that will help. And we will be pushing upwards because we need to obviously lift and raise our face. Alright, and I recommend that you have a blood test done. Okay, I will contact your doctor and get that set in motion. I want to see if you're lacking anything. I want to see if you've got any inflammation in our body, and I want to check for a couple of autoimmune diseases as well, my lovely. Alright, there's nothing to worry about or to be scared about, but I just want to make sure and cover all bases and make sure that everything is fine. Yeah, just to be on the safe side. And I don't need to carry out a full cranial nerve at this stage, as you're only experiencing this issue here and there's no problems elsewhere. I don't feel it's necessary to carry out a full cranial nerve exam, but if we need to down the line, then that could be done. Alright. Okay, so you've definitely got tension, you've definitely got weakness, numbness, and obviously the measurements are significant but not drastic. Alright, okay. And I will need to be monitoring you closely with this treatment though, my lovely. I don't just want you to go away and then that's it. I would like to check in with you every couple of weeks if that's okay, and I'm happy to do that as a phone call if that's easier for you. Alright, good, so we can start the treatment ASAP. I will leave you a week to get your treatment sorted because I know what it can be like at chemists, and I will book an appointment then to call you in about 3 weeks' time. How's that sound? Okay, I'll do that for you in a moment, and I can call you. Alright, and just have a think about, you know, if there's anything troubling you or anything like that, if you need to speak to somebody, maybe some therapy or, you know, something like that. If you just want to offload a little bit, yeah, it might help. We just need to think of lowering our stress levels down. All right, so I will do a report, send it all over to your doctor and yourself, and then the doctor should get in touch with you to do a blood test, and I'll be sent those results as well, and if there's a problem we can treat accordingly and start all this treatment that I've asked you to do, and then we'll talk in a couple of weeks and see if there's been any improvements. All right, so let's book you an appointment. If I can find my phone. Oh, it's over here. Okay, let's get my diary up. But it's nothing to worry about, my lovely, okay? You haven't left it too long, so, you know, we can get treatment sorted and nip it in the bud. All right. I don't feel it's necessary to do any other kinds of scans or anything like that, but, you know, if we're going through, you know, a couple of weeks, whatever, things are getting worse, and things like that, then I could obviously issue an MRI scan on the brain and potentially carry out a full cranial nerve exam. All right, but as it stands at the moment, I don't feel that's necessary. All right. And you've had no cold sores or anything like that, so I don't think it's from the herpes simplex virus. Right, how is 3 weeks time? 25th, any good for you maybe? Okay, what time suits you? I can do that for you. Okay, you should get a text now. Perfect. So that is all booked in for you. I will give you a ring in 3 weeks, and hopefully we would have had a good time at starting our treatment and all the recommended things. All right, but please don't worry. You're in perfectly safe hands, and I'm not just going to leave you. I'm here at the end of the phone. If you do need me, please just pick up the phone and give me a call. All right, but hopefully we can get the ball rolling and get some bloods done and see if there's anything else happening that we need to be made aware of. All right, my lovely. It was a pleasure to meet you. And like I said, please get some rest and try and lower those stress levels. All right, my lovely. You're very welcome. And I will speak to you very soon. You take care now. Bye-bye.